Morning, everybody. Her Excellency, I'm joined today by our PR for the Philippines in New York, His Excellency Antonio Lagdameo, sir. To our Western Pacific Regional Director, Dr. Piucala, to all of our health advocates here, our colleagues, a pleasant morning to all of you. Hepatitis, particularly hepatitis B and C, remains a significant public concern in the Philippines. Around 1 in 10 people have chronic hepatitis B, and 6 in 1,000 have chronic hepatitis C. The country has one of the highest rates of hepatitis B in Southeast Asia, with an estimated 7.3 million Filipinos chronically infected. This chronic infection is a leading cause of liver cirrhosis and liver cancer, making it a critical public health challenge. Hepatitis C also poses a threat, though less prevalent, with an estimated 1% of our population affected. The disease is often underdiagnosed due to limited access to testing and healthcare resources, particularly in our rural areas. The Philippine government has implemented a multifaceted approach to combat hepatitis, encompassing national initiatives and international collaborations. Historically, global organizations like WHO and UNICEF had been pivotal in supporting the country's hepatitis management efforts. A key achievement is the inclusion of the hepatitis V vaccine in the national immunization schedule in our country. In 1989, we have started a 3-tiered hepatitis control program. First, encompassing mass infant immunization. Second, blood and blood product screening. And third, public health education. To further strengthen our response, the Ministry of Health currently developed a viral hepatitis national action plan for 2025 to 2030. The WHO also has assisted us in developing national guidelines and policies promoting the adoption of the 2016 Global Health Sector Strategy on Viral Hepatitis. This strategy aims to eliminate hepatitis as a public health threat by 2030. Additionally, the USAID has provided technical support and funding for hepatitis prevention and control programs in the Philippines, furthering bolstering our country's efforts. The country has implemented several key initiatives to combat hepatitis as mentioned: administration of hepatitis B vaccine within 24 hours after birth, and efforts to screen pregnant women and newborns. The Ministry of Health in the Philippines also launched awareness campaigns to educate the public about hepatitis transmission, prevention, and the importance of vaccination. In the recent years, the country has expanded its efforts to already include hepatitis C, introducing programs aimed at increasing access to diagnosis and treatment. These initiatives are aligned with the broader goal of integrating hepatitis services into our universal healthcare program, ensuring that all Filipinos, regardless of socioeconomic status, can access the care that they need. Access to hepatitis medicines in the Philippines has been a critical issue, particularly those suffering from hepatitis B and C. The availability of these medicines has often been limited all over the country. And to address this gap, the Global Fund to Fight AIDS, TB, and Malaria provided financial assistance and resources to enhance access to these life-saving hepatitis treatments. Through the Global Fund's initiatives, the Philippines has been able to procure and distribute antiviral medications. We have improved our diagnostic services, and we have strengthened our healthcare infrastructure, ensuring that more of our Filipino people can access the treatment that they need to manage and control hepatitis effectively. In closing, we would like to emphasize 3 major points. First, strengthened and recognized integration of hepatitis in our primary healthcare services in the context of universal healthcare. From awareness strategies to early detection to our treatment strategies and further to control this disease in the country. Second, data generation and eventual analysis of these data. In the Philippines, we lack the database for all of these hepatitis cases. Most of the cases will be left undetected or misdiagnosed. That's why the numbers, we think, are still not complete in case of our country. And the third, most importantly, we'd like to emphasize that there should be this multi-sectoral strategy, that we recognize that most of the risk factors for hepatitis are all outside, or most of it are outside the control of the healthcare sector. While hepatitis remains a challenge in the Philippines, sustained efforts by the Ministry of Health, this kind of events and support from our international partners, cooperation, we believe that we can have that kind of progress to control the illness or this disease in our country. Through this ongoing collaboration and commitment, we will be able to eliminate hepatitis as a public health threat in the coming years, not just in the Philippines, but all over the world. Thank you very much.